disease epidemiology and management. So without further ado, Dr. Achebe, please take it forward. Thank you.
Thank you so much, Ms. Giwer. Can everyone hear me? All
Yep.
right. Thank you.
Yes.
So, good day to everyone. I know we're all in different continents, and welcome to the second panel titled AI in Training and Capacity Enhancement. I'm honored to host this session, and I'm really thrilled to see so many professionals joining us to explore the future of learning. I just want to say big kudos to the last panel and to the Ms. Vamchi. I learned a lot from your opening remarks, and thank you for that. So we're currently witnessing a pivotal moment where AI is moving from experimentation, as some people said earlier on, to the core of organizational strategy. In this 2026, the World Workforce Outlook shows that AI literacy is now non negotiable, and employees are looking to employers to provide that training and build human capacity. So, AI offers a powerful opportunity to strengthen capacity by identifying knowledge gaps, personalizing learning, and automating routine training tasks. It's not just for tech companies, but it's also transforming HR systems, healthcare, education by really enabling personalized, high impact capacity building. I was at a conference not too long ago on AI in Black Farmer, and one of the speakers said something that resonates and would stay in my memory for forever. Talking about equity and saying, for the first time, we have something that is free for everyone. There's no inequity. When the computers came, it depends on how much money you have, or the cell phones. Well, AI is open to everyone. So, over the next 25 minutes, we will discuss how to implement these technologies responsibly, focusing on both the efficiency gains and the necessary human oversight. So, for this panel, I'm really honored to have two experts in the field to guide us through this transformation with the ultimate goal of bridging the gap between technical AI possibilities and practical human centric applications. So I'm asking that you join me in welcoming Dr. Esther Oshunluyi. She is the CEO of H-led Healthcare Leadership Advisory Network, and also Professor Azad Mien, who is the head of healthcare transformation, learning programs, and systems of the Evercare Group. Unfortunately, Professor Azad is absent due to a travel conflict, but he has graciously provided his inputs via a video recording. So we hope that at the end of this panel, you leave with practical insights to upskill your teams. And please, continue to feel free to ask questions in the chat as we go along. We'll try and leave the last 5 minutes to go through all the questions asked, unless our experts, I mean, it's just Dr. Shunlui here, provide responses. But if you do have questions after listening to Professor Asad's presentation, please also put it in the chat. So I'm going to turn to my esteemed panelists, to Dr. Esther. I'll ask the first question, but I ask that you start your first question, responding to your first question by talking a little bit about yourself and the vast experience you bring here. So my first question is really setting the scene on the why. So Dr. Shunluyi, as we move from 2025 into 2026, I mean, we have moved already. We've seen the shift from simple experimenting with generative AI to attempting to scale it. In your view, please, can you tell us what the single biggest opportunity AI offers for training and capacity enhancement right now? Over. Thank you.
Thank you very much, Dr. Achebe. And good afternoon, good morning, and good afternoon, everybody. Thank you very much for inviting me. I'm Dr. Esther Oshunluyi. I'm the CEO of H-Lead, Healthcare Leadership Advisory Network, an organization focused on leadership development, workforce training, and capacity building within healthcare and public sector systems. Our work centers on strengthening institutions through intentional leadership development, education reform, and system readiness. We support initiatives ranging from practice setting strengthening to renovation, digitalization, and reaccreditation of training institutions, including transforming them into smart campuses with modern libraries, ICT infrastructures, and so on. We approach AI not as a standalone technology, but as a capacity multiplier. Now, my interest in AI is grounded in practice. How intelligent tools can enhance training, support healthcare workers, and strengthen healthcare systems without losing the human touch. And I'm pleased to be part of this conversation. So, to our first question for today. The single biggest opportunity AI offers right now is actually the ability to scale training without losing quality. Its ability to scale training. Because like someone said, we are no more practicing, we are here with AI. Until recently, organizations had to choose between training more people or maintaining depth and consistency. What AI does is it allows us to do both. It shifts training from only evidence-based to continuous, moves learning from one size fits all to competency-based. It frees us, human trainers, from repetitive delivery and focus. Now we can focus on coaching, critical thinking, and quality assurance. In my experience leading capacity building and transforming training institutions, in America and in Nigeria, the real breakthrough is not actually the tools. It is how AI allows consistent standards to be applied across locations, cohorts, and skills level. Example, at the College of Nursing in Edo State, Nigeria, when we completed that school and we were bringing in faculty, management, and staff, we were to bring in almost 200 personnel in a very, very short time. Now, luckily, Edo State government has the infrastructure already on ground. The office of the head of service, who was leading the initiative, the recruitment, and the ICT agency of Edo State. These two departments, they were highly digitalized. For us, I was a consultant working with Canada at that time. And we were able to actually bring this team in. All the training, everything was like streamlined because we had all this technology infrastructure in place. And because we had leadership buy-in, because there was infrastructure and there was governance, it was easy for us to be able to leverage AI to have a successful outcome. Now, another thing this did was faculty efficiency. In this school, the faculty were trained and retrained with AI. The team, the faculty, the staff, and the students, all their programs, they were AI compliant. By the time the first set of students graduated from that school, and this was recent, they graduated in 2024, the school scored 100% in their board exam. And another thing AI does is that real time, we can actually track real time learning outcomes with AI, also with onboarding. So I believe the opportunity for AI is actually the opportunity for AI recently is actually because the opportunity we have now is that the success depends not only on technology, but on leadership, governance, and system readiness. The shift from delivery to development is where the real value of AI is currently. Thank you.
Thank you so much, Dr. Shunlui, for that, for really talking about how the AI has really helped with the employees' career goals. So I'll just ask you another question. Really thinking and looking ahead, what does the ideal blended human machine workforce look like in 2026? What skills will remain essential for human trainers that AI cannot replicate? I've just, reflect back on Ms. Vamchi's remarks when she said, AI is your colleague. AI is not your, I'm paraphrasing, AI is not your brain. So, what skills will remain essential for human trainers that AI cannot replicate? Thank you.
Thank you very much for that question. And that is one of the greatest concerns of us working in healthcare. The ideal blended workforce is not about humans versus machines. It is about task alignment when we talk about AI. AI can handle content delivery, data-heavy repetitive tasks, assessment scoring, learning analytics, and AI can actually handle progress tracking. However, for human beings, we can focus on what AI cannot replicate. Human trainers remain essential for critical thinking development, ethical judgment. AI cannot give ethical judgment, contextual decision making, mentorship, which is very, very important in healthcare, mentorship and motivation, as well as cultural and organizational alignment. Human trainers are still essential as coaches, as evaluators, as culture builders. AI will support capacity. However, humans will still need to preserve quality and trust. Training and retraining in the nuance of AI is the way to go. AI can identify all the gaps, but it is only human who can interpret the meaning and guide the growth in this AI. In 2026, effective training will be less like lecturers and more like coaches and system thinkers.
Thank you. You have really left something in my brain, less like lecturers and more like coaches. That is really a very impactful feedback. So I'm going to turn it over now to give you some time to take a breather. I'll turn it over to Professor Azad, who has graciously responded to 3 questions I threw out to him. The first question was on why. That as many organizations struggle with work slop, low quality AI output, how do we ensure that AI powered capacity building actually increases quality rather than just increasing volume of training content? He's also going to answer a question on AI in training, how it can really, how we can avoid bias, and what mechanisms should organizations have in place to audit their AI training tools for fairness. And my third question to him is really on what should organizations be doing now to prepare their workforce for the change fitness required to work alongside AI. So I'm going to ask the organizers to please turn it over to the video with Professor Azad now. Thank you.
Thank you, Dr. Kechi. So our colleagues will play the recording from Dr. Azad. So
Hi, everyone. I hope everyone's doing well. My name is Asad Mia, and I am a professor of emergency medicine, currently heading healthcare transformation learning programs and systems across the Evercare platform. We are a private equity-backed healthcare system with hospitals across Nigeria, Pakistan, and Kenya. My role is to look at processes through the design thinking lens and then figure out with the teams on the ground where we can enhance the processes so that they become more efficient, patient safe, with clinical excellence and staff engagement. Having said so, this topic that has been given to me today, AI, building training and capacity, is of great interest to me because the work that we've done across Evercare is very experiential and very experiential work that's been done in real hospitals. And so I'll be able to give you input from practical lived experience and versus pedagogy or theory. So without further ado, let's get going. I'm going to cover 3 questions that were given to me. The first one was around AI slop or work slop. How do we ensure that whatever is coming out of the AI we're utilizing, it's not just content for the heck of it. It is actually meaningful. So this slide gives you our AI philosophy. We use